Hi, I'm Mel. I'm going to be talking about metformin or glucophage. So, this is an anti diabetic medication that is given to patients with type 2 diabetes mellitus to help with the treatment and management of their diabetes. Because this medication is not going to cure their diabetes, it's probably going to be a long term medication that they'll be on for a while. The way that it works in the body is that it decreases the production of glucose in the liver, and it's going to decrease the absorption of the glucose within the intestinal tract. It's also going to increase the insulin sensitivity to the body so that insulin can work a little bit better. Some of the outcomes that we look for in patients taking metformin is the control of those blood sugars and the minimizing of the short or acute episodes of hypo or hyperglycemia that they may encounter. For the full effect to take place with this medication, they'll have to be on it for about 2 weeks. They may feel it within a few days and see the changes in their blood sugars in a few days. But if they don't have any changes within 4 weeks, their provider may decide to put them on a sulfonylurea, and that's just going to aid in the production of insulin in the pancreas to help the body move that glucose where it needs to go. If there's no changes and there's no effects with the metformin in patients within 1 to 3 months, the provider may decide to take them off of all oral medications and place them into an insulin therapy. Dosages for metformin it's going to typically be 500 milligrams twice a day for all patients 10 and over. That medication, that number can increase by 500 milligrams every week to see and find out where that therapeutic dose is per patient. That number can go up to 2,000 milligrams per day for adults and children 17 above and children 10 years old and above. So if they're 17 years old and older for children and then for adults, that 2,000 milligrams is going to be split into 3 separate doses. For children taking up to 2,000 milligrams, that dose is going to be divided into 3 separate doses. So patients want to be reminded that they can take this medication with meals, and that's also going to help with minimizing GI upset, any nausea, vomiting, diarrhea that they might encounter, any abdominal bloating. It's just going to kind of help with that. If they're on an extended release tablet, they can still take that with medication, but they need to be reminded, with food, and they need to be reminded that they can't chew or cut up that extended release tablet. So they also want to be reminded to take their blood sugars either daily or at least periodically, depending on what their provider wants them to do. Some of the side effects that they may experience is that abdominal bloating or abdominal pain, nausea, vomiting, diarrhea. They may have a metallic taste in their mouth after taking the medication. And then they can also have what's called lactic acidosis, which is buildup of lactic acid in the muscles due to oxygen not getting to it to be able to break it down. They want to report signs and symptoms of hypo and hyperglycemia to their provider. They also want to report if they're planning on being pregnant, planning on becoming pregnant, if they're having recurrent GI problems like that nausea, vomiting, if that's just not going away at all. They want to let their provider know, as well as knowing the signs and symptoms of hypoglycemia and hyperglycemia. So some of the things to look for hypoglycemia is a blood sugar below 70 milligrams per deciliter. They're also going to look for shaking, dizziness, hunger, irritability, anything like that may occur. They'll want to talk to their doctor about or go to an ER if it's extreme. For hyperglycemia, they're going to look for a blood sugar that's above 180 milligrams per deciliter. And some of those signs and symptoms are going to also be headaches, extreme thirst, frequent urination, weight loss, trouble concentrating on things. So any of those, they're going to want to talk to their doctor as well and let them know that the metformin is probably not working as well as it should. We also want to remind our patients that their hypoglycemic levels is probably going to be higher than the textbook hypoglycemic levels if their body is used to being above 180 in the 200s or 300 range. If they get down into the high 100s, still above 180 or 150, give or take, they may experience the signs and symptoms of hypoglycemia because their body's not used to running on that low of a blood sugar. So they need to be aware that that's still okay to take their blood sugars, to still let their provider know that these effects are taking place. And that's everything for Metformin. Thanks.